to live and reside and trade anywhere in this country, so we cannot curtail that freedom. But I will proceed to comment on the statement by Senator Mwaruma on the chief. Madam Speaker, it is really disheartening that we have reduced the health of people into a mechanism of extracting money from the poorest of the poor. SHIF is an extraction mechanism for stealing from the poor, because if we really wanted universal health care, we would begin by fixing public hospitals. We have not done that. Instead, we are forcing people who otherwise would have enjoyed cover to pay annually when they don't have capacity. People should be allowed to pay according to their capacity. They would have to enjoy a cover that is given by the state. But all said and done, Madam Speaker, the SHIF arrangement is an extortion mechanism, and that's why they are prioritizing to get as much money as they can from the Kenyan citizen. And that needs to be stopped, so that if the issue is to give people health care, let us fix the health system, let us get the hospitals working, let us get the doctors in public hospitals, and let us run universal health care on public hospitals. Running universal health care on private hospitals is opening an avenue for looting from state coffers. So, Madam Speaker, I support this motion, and I pray that when the committee looks at it, it does a holistic job of looking at the entire architecture of universal health care, including answering the question whether you can credibly run universal health care on private hospitals. Thank you, Madam Speaker.
Thank you, Senator Omtatah. Senator Okenyuri Esther.
Thank you, Madam Speaker. I wish to comment on the statement by Senator Catherine Muma on unchecked inflammatory utterances by influential public figures. Madam Speaker,